give credit where it's due. Marco Rubio killed Obamacare, and it's on its way down right now because of the blow that he dealt it. Rubio understood the real weak link in Obamacare, that on the one hand, the government required insurance companies to cover everybody, and on the other hand, the insurance companies had to keep their rates low enough so that everybody could afford to buy their insurance. Now, originally, the rates were cushioned by federal subsidies and tax credits, and that was an effective strategy as far as it went. But the subsidies could only cover so much, and they only applied to premiums, not to deductibles, which have averaged $3,000 and in more than half the cases higher than $3,000. What Rubio understood was that the only way Obamacare could survive is if the insurance companies were guaranteed against losses. That as the insurance companies raised rates, fewer and fewer young and healthy people would buy insurance, and the pool would get sicker and older, and that would force rates higher and higher, and the fewer and fewer people would enroll, what in the insurance industry they call a death spiral. And Rubio understood that the only way around that death spiral was the commitment embedded in Obamacare that the federal government would absorb the losses of the insurance companies, that you could write the policies and lose as much money as you wanted. The federal government would come to your rescue and bail you out, not just out of your costs, but would actually guarantee you a profit. In effect, it made health insurance a utility. Rubio killed that. In the budget deal last year, he pushed through an amendment that killed that subsidy, calling it corporate welfare. And the Democrats really didn't understand what the amendment would do. I'm not sure Obama understood it. And Rubio got it passed, and as part of the budget bill signed into law by the president. Now, without that subsidy, without the federal government having their back, the insurance companies are looking at the pool of people they have to insure, looking at the costs, looking at their losses, and running screaming. United Healthcare has lost almost $1 billion in covering Obamacare patients, and its stockholders are demanding that it get out of the Obamacare business. And United Health is the largest health insurer in America. And the other health insurers are going through a similar process, albeit delayed by a few months, and are increasingly understanding that they will never be able to make ends meet in the Obamacare program. So the crucial link between the benefits on the one hand and the patients on the other hand, the insurance companies, is now going away, and Obamacare will no longer have the means of getting a subsidy and delivering the service to the ratepayers. It's a situation that is fraught with peril for Obamacare. Peril's the wrong word. Certain death for Obamacare. Now, where will that leave us? Well, under a Republican Trump presidency, it'll leave us with a mandate to replace Obamacare with something else. And that something else would obviously be some system of tax credits, but without a mandate to buy the insurance and without these crazy rules as to what insurance must cover, but probably would cover things like pre-existing conditions and children through age 26 and stuff like that. Under Hillary, it'll probably lead to socialized medicine, single payer. If the insurance companies aren't willing to stand in the middle, the government will. And the government will provide the benefits, pay the money, employ the doctors, employ the hospitals, and run the entire system, just like they do in Canada and Britain. So our choice in the coming election is really our last chance to stand for private health care. The halfway house, the compromise, the missing link of Obamacare will be gone, and we'll have a choice between a private system and a public one. Thanks for watching.